Welcome to Rehab Unplugged. We dive deep into physiotherapy and rehabilitation, bringing you honest conversations with industry experts and uncovering the tools and stories shaping the world of rehab today. Let's dive in.
I'm Andres, your host, and today we have the privilege of speaking with Lincoln Blandford, the Head of Research, Education and Development at Comera Movement Science. Welcome, Lincoln.
Hey, Andres. Good to see you. Thanks ever so much for this opportunity to, have a conversation.
Absolutely. It's really good to see you as well. Lincoln, you also have collaborated closely with experts like Mark Comerford, Dr. Mottram over the past 15 years to design and deliver educational programs such as Kinetic Control, the Performance Matrix. So I don't know if maybe you would like to expand a little bit more on that.
Well, it's been quite an interesting development and journey because it's been not only, I guess, developing education, but part of this role is to also work on the research side of things. So there's also been a lot of writing, trying to explore the meaning of movement and how it's used in sort of clinical and performance settings, as well as then delivering that through education to practitioners so they can take that and use it with individuals. So that's where it really matters.
Wonderful. I guess before we dive into movement science and technology, let's take a step back and talk a little bit about movement itself. It's something we do every day without thinking, but when we break it down, what's movement really?
Okay, yeah, I mean, it's an excellent place to start this conversation, and I think it's one that sometimes is missed. There's an assumption that we know what we're talking about when we talk about movement, and depending on who we're talking to, that's not always going to be the same interpretation of this thing. I think what we can say, it's certainly part of human behavior, and what we can also say, there's many different ways we can go about measuring it, so we can consider which SI unit we're considering when we're looking at movement. And that sometimes helps us to get an indication of who we're talking to and what their views are on what movement matters. So this might be, you are looking at things such as how much distance you've covered in terms of movement, how quick you're moving. So those features, it could be the kinematic, so how your segments move, the joint angles, the kinetics underneath this, that produce movement, the forces involved. Then you can dive down deeper into the EMG activity, another level down, the metabolics, what's actually powering this in terms of different energy systems. Then you can go for MRI type analysis, what's going on with the CNS, or what's going on in the sort of nervous system per se. And this is not even to mention intentionality in the psychological features of movement. So actually, you can consider what somebody's doing, how they're doing it, but also why they're doing it. So you can see it's quite complex. And depending on what your perspective is, we might be talking a different language when we're talking about movement.
There's been a significant shift towards using data and technology in rehab and performance over the last decade. So from your experience, what's driving this change and how is it reshaping how we approach movement science?
Yeah. So I think as we just identified there's lots of ways we can measure movement. Now, what that means is that's generating lots of data through this technology. So we've got wearables, we've got computer vision, and a whole range of different ways to do this. It's allowing us to have more data and capture it in more places, so we can have more realistic interpretations of actually what people do. So this is quantifying movement because people want to have an evidence-based approach. And the belief is that if we can measure it, that's going to give us more evidence in terms of then delivering it to individuals, again, within private practice, within elite sport, within high performance. And this is all steering towards this personalized intervention. So if we can quantify the individual, there's more chance that we can actually then better deliver interventions for that person, that one individual person.
When you apply this level of insight to clinical and performance settings, how does it change the approach to creating treatment plans? Because we are in an era where we are recording so much data everywhere. I think a lot of people nowadays, they have a wearable, an Apple Watch or a Fitbit, and all these things are recording all the time information. How does that help your therapist to provide a more personalized experience?
Yeah. Well, the assumption is it does help. So we have to also consider the alternative to that. Maybe it might not. So what we've got to do is, within all that data we have, is interpret it. It's an interesting thought to consider that a way to think about what a pattern is when it gives you a predictive edge on your data. So if you can start to find patterns in data, then you go, okay, this is meaningful, I think, and it's going to guide you in terms of helping that individual. Now, you could also then think about movement patterns as when we can identify something in movement that's meaningful, you could describe that as a movement pattern. We've got tools of analysis, so machine learning, for example, which is designed, it's taught to find patterns. And that's good. That's really useful, because with all the data we have, how do we actually make meaningful sense of this? One challenge that is, though, that these technologies, because they're designed to find patterns, they might find patterns that they don't exist, or they're not actually meaningful in terms of that individual. So we've got to be always aware that that's the case. However, let's go down the sort of optimistic route that what we're finding is meaningful. Because we've got many different characteristics of movements, we've got to then try to profile that individual. And from all the noise that we might sort of extract from the data, to go, this is the profile that matters for them, for either the goal they're interested in terms of pursuing in performance, or is this related more to a health outcome? And by which I mean, this could be associated to injury risk or the rehab of an injury. And we can't assume that performance equals health. So again, what we see within elite sports settings is we might be driving for performance, but that could be at the cost of athlete health. And we might also see that within recreational athletes as well. So just to center back to your question, how is this helping us? Well, it's generating a lot of data, and we're trying to make sense of that to profile for that individual. And then what we want to do is be able to pick the salient points and then deliver interventions that change that individual towards what they need, towards what they feel they want, and towards also what, I guess, the evidence would say is meaningful as well, and what matters.
Can you share examples or an example where technology-driven data significantly improved a patient outcome?
Okay, so within the ranges that are available, what we've done within Comera Movement Science, for example, is we've focused very much on the coordination abilities of individuals. So how they coordinate movement. What I mean by that is how they move certain regions compared to other regions. So they coordinate one segment by maybe trying to prevent motion at that region whilst moving another segment to specific benchmarks. Now, this type of testing and then intervention can bring about change in how people move in terms of the kinematics. So you would use motion capture technology to identify that parts of their body change and move differently after these interventions. Plus, below the surface, below the waterline of what we can see how they move, but below the waterline, their muscle activity also changes. So we've got some research to support that through using this type of approach, that we change how they move, but also what's producing that movement. Now, an example of that with a case study was my colleague, Sarah Mottram, 2019, published a paper where she worked with a rower who was suffering from hip pathology problems. So pain in the hip that was preventing her from rowing. And following a intervention that was guided by this type of testing, where you would assess movement, you would then put that the data in terms of what you found during the movement testing into an online platform. It would quantify the risk associated to these particular movements that would then guide what the intervention was. So you would assess, put the data into an online platform, that would throw out through the algorithm, this is what that means in terms of risk. That would then guide the intervention. Now, the intervention brought about changes in terms of symptoms, which is really good because this person had symptoms. After this, those symptoms were much reduced. They could return to rowing, but also it's changing EMG activity of muscles, but also you're getting these change in terms of how they move. So the, again, pelvis motion was influenced by the intervention. So we're changing how they move, the underpinning muscle activity for this, but most importantly for the individual, they can return to sport and have got reduced pain. So how is the technology helping that? Well, through the intervention, which is coming out of the web-based software, which is coming from the assessment that's done qualitatively, ideally what we do is have a way to quantify the assessment process. Now, that might be through wearables. It could be through something like computer vision, where we can make sure that more people could be assessed in that way. You then put that data into the technology, it puts out the report, and then that guides the intervention. We're not quite there yet in terms of harnessing wearables and computer vision within this process, but I know others are certainly pursuing that very strongly.
What advancements do you foresee in the integration of technology and movement science?
Movement's a really tricky one because what we've seen is sometimes if the practitioner told the patient everything they knew, that might really start to influence how the patient starts to move. So that's really tricky. So the practitioner has to be very careful about the words they use, how they deliver interventions. Even when they're testing movement, they've got to be cautious about the words they're using and how they're then giving those results back to the patient, to the individual. Where's this going to go? It could be that the practitioner at some point is removed from the process. It could be that we get to the stage where the client is so trusting in the AI that they have a completely automated health support process. They say, well, okay, today I do my scan, I'm profiled, and day by day they have the information. And then day by day they have a slightly different intervention. Today I need to be careful of this. Today, I can go and do this. That could be where this goes. You have longitudinal tracking of health that is a day by day feedback, which guides you what you can or what you should or what you'd be best doing today. So that's of interest because I guess we're all going to be that individual, but also it's of interest to the practitioner because they've got to think, well, how do I operate in that world? Where do I still fit in with it? They still have a big role to play in terms of the clinical reasoning process now. They still have a big role now in terms of their skill sets. So the ability to qualitatively assess movement, the technology isn't as good as that yet. That's what I perceive anyway. I see the best people in the world who can rate how somebody moves, and I don't see the technology doing that as well yet. I think it will at some point, and also at the clinical reasoning stage. Making that decision about, what does this mean for this person? At some point, the AI could get that good that it does start to make those decisions as well or or better than the best in the world this time.
Yeah, I guess that question really opened a lot of doors. Definitely, we have an opportunity to do another podcast episode to talk about the future of AI in the rehabilitation therapy. Yeah, it's so interesting. I also believe that human touch is so important always. I think to create that trust between the therapist and to the patient is now and will continue to be so important always. But you're absolutely right, Lincoln. I think it's super important to understand how AI will fit into this puzzle so that maybe will be an extra tool that we will have available but at the same time, we'll continue building that trust between therapists and patients.
I really hope so. I really hope that the practitioner has still a big part to play in this. And I think that's a nice point you're making there, that that human touch element, maybe that can never be replicated in exactly the same way as that practitioners do that well now.
Absolutely. We talked a lot about how data and technology are shaping the treatment strategies. So for clinics and practitioners who are looking to integrate these insights into their practice, what resources are available to help them to get started?
So I've mentioned a little bit about, I guess, the processes we use within Comera, and we've sort of probably best operationalized this within Performance Matrix tool, which is the sort of web-based platform I mentioned that was used in Dr. Mottram's research with the ROA, and we've used this in a number of other pieces of research. So that's probably a tool that brings a lot of this together. It's a web-based platform. You have a login as the practitioner. You then go through a series of tests with your client right there. You either show them the videos or you'll demonstrate this test yourself, depending on how you get on with that. And then you qualitatively rate specific features, specific characteristics of movement. And we focus on coordination a lot within this. That generates this report, and then we move into intervention. Now I can, shall I do a little bit of a share screen to show some of this stuff?
Absolutely.
Okay, so let me just go there. Okay, so what I've gone to now is inside the Performance Matrix system, and we're looking at one of the tests here. Now, all the tests, well, any movement test, you think, well, okay, I'm going to sort of rate movement. You can have this idea of rating movement competency, and you have this sort of, oh, it's good, or it's not so good, or it's really, really not good. The tests in this process are not really like that. They're incredibly specific, and they do have a pass or fail. Either you can or you can't do something. And what every test has is a benchmark that a region has to get to. So you might need to bend your knees to maybe some sort of 40 or 60 degrees of depth. And then as you do that, there are questions around, well, as you achieve that benchmark, can you prevent the pelvis tilting or moving into a specific direction? Now, why it's a test of coordination is, as you bend your knees, can you prevent motion occurring at another region? With a view that if you can't, and you consistently can't, even when you've been given instruction, you've been shown videos, it's been demoed to you, so the practitioners try to teach you as best they can about how to perform the test, and you still can't do it, we would think that that's a loss of variability in your movement. So you've got reduced variability in your movement for this particular site, the pelvis, into a particular direction, anterior pelvic tilt, for example. Over the course of testing, over a battery of tests, we're trying to reveal where you've lost this variability in your movement consistently. So in a number of different places, or all the same place, you consistently move in a particular way, with a view that if you consistently move in a certain way, those tissues are stressed repeatedly. And that then could lead to overuse type injury, or even an acute injury, because you're going into a high speed run and you've already got demand on those tissues. So we've got a number of tests to try to reveal these particular sites and directions of what I would describe as low coordination variability. We do it under different loading strategies, so postural type loading, non-fatiguing, plus also strength and speed type activities. Now, once you've done your testing, say it's 10 tests or 4 tests, depending which one of these different batteries you run, you then go to a reporting screen. And what the system does, it's got an algorithm baked in that weighs up all the different test results, and for that particular person presents you a profile of guest coordination variability, where they consistently have failed specific tests at specific regions into specific directions. So the directions matter. So if you consistently fail, the idea would be that specific tissues will be challenged by that particular movement. That might have relevance if you're interested in something like hamstring strain injuries. So it's sort of the research I've been looking at for some time. Now, once you get to the reports, this is where the human interaction comes in. The practitioner needs to make a decision about what matters. You might have 5 or 6 different things that this client has failed. You need to make a decision. What are the 1, 2, or 3 things that really, really matter? Once you've decided that, you can then spin over to Wibbi, HEP, so an exercise catalog, and you can select which exercises you're going to select for this person. Now, what I mean by that is the Wibbi HEP is set up so that you can select low back pelvis, going into extension. So you can select the site, the direction, and then also whether it happened under fatiguing loads or strength loading. You can then select your videos, your exercises, the ones you think are most appropriate for this person. You can then package that into a program, and you can then email that off to the individual, as well as going through those interventions in a live setting to make sure that you've delivered it as required. So the technology supports the individual because they have this to take away, and the technology has guided the practitioner through the web-based platform, but also through the algorithm of risk for which coordination test they've consistently failed. So that's a process. That's the performance matrix in terms of from testing to reporting, decision making, to then the use of interventions.
Thank you for sharing those insights on the pivotal role of technology-driven data in enhancing treatment plans and patient outcomes. Thank you very much for being here with us. Your expertise offers valuable perspectives for clinicians and performance specialists alike. And thank you to our listeners for tuning into the Wibbi Podcast. Thanks, Lincoln.
Thanks, Andres. Thanks for this chance to talk about this stuff. And it's some great questions there, so thank you.